The Ontario government released new projections for the COVID-19 crisis, and joining me now for an update is our MPP, Jim McDonell. Welcome, Jim.
Thanks, and thanks. It's good to be able to contact our people from the comfort of home.
All right, so let's start with the projections that we heard today from the Officer of Health, and I'll get your reaction to that.
Well, I think it speaks volumes to, we've had the benefit of looking around to some of the other countries that have gone before us. So the numbers are frightening. So we're looking at upping just where we go with the measures that we think we can contain that down to somewhere between 3,000 and 15,000 deaths in this province over the next 2 years. So it's as it rolls out, it's certainly something we haven't seen for over 100 years.
Absolutely. Now, of course, more orders could be on the way, but we know that the list of essential services has been updated. I'll get your thoughts on that.
Well, they've done. Of course, we had an experience of the last few days looking at how the system's been working, and it has restricted more services with the idea that looking at the projections, we need to tighten up just, contact between people, shutting down any large construction sites, reducing the number of essential services even further. And it's really all about, making people stay at home, reducing that contact while we ramp up and get supplies, and even over the long term to make sure that we don't outpace our medical supplies and medical capabilities.
All right, and we know that the province, on that note, has been working with the federal government, and the feds have announced a significant amount of funding to work with the provinces to ensure that we do have enough medical equipment. Maybe a quick update on that, MPP.
Well, the federal government has taken over all of the procurement to make sure that they are able to maximize it to the greatest extent and to distribute them to the provinces as required. There's no question that we've been able to turn industry around. We have at least 1 or 2 car plants are now making ventilators. We have all kinds of products being turned around. That takes some time. But we're hoping within the next 2 or 3 weeks that they'll be putting these products out really at a very high rate, so we can supply right across the country.
Excellent. And the Ontario government has also announced a couple of funding streams, $2.7 million for mental health services, a very similar number for domestic violence cases during the COVID-19 crisis. Maybe an update on both of those fundings.
Well, 2 unfortunate issues around an occurrence such as we have here. There's no question that domestic violence increases when people are contained in small areas, as well as mental health. It's another issue. People aren't able to get out as much as they used to, so it adds a lot of stress. And so we've taken some steps to make sure there was money available to the groups that look after these unfortunate victims, and to make sure that they have the money to actually help them and move them on through this trying time.
And another funding stream that was just announced very recently, I believe our mayor announced it yesterday, was some more money for social services as well that will be coming in from the government through to the municipalities.
Yeah, we're looking of course, we're spending, I think it's over $3 billion extra on these services. It's getting money to the municipalities quickly so that they can provide these services. In the best of times, we have people that are unfortunately out of work or unable to work. With the situation we have today, that number is just skyrocketing. So it's about getting money out to the community, out to these important organizations that do a lot of good work, and now they're of course being strained to their limits.
On that note, MPP, thank you so much once again for joining me and updating our viewers.
Well, and thank you for that. And again, the viewers, just to make sure you do what you can to limit the spread, stay safe, stay home. The message is really about staying home.